Okay, so today we'll be talking about exposure and technique errors. And this is on chapter 20 of your general radiography textbook. So first, let's go over some learning objectives. This will be to define the key terms associated with exposure and technique errors. We'll identify and describe the appearance of the following exposure errors: unexposed receptor, film exposed to light, overexposed receptor, and underexposed receptor. Will identify and describe the appearances of the following periapical technique errors due to receptor placement, which is an absence of apical structures and dropped receptor corner. We'll also describe horizontal and vertical angulation and identify and describe the appearances of the following periapical technique errors due to angulation problems. So this is incorrect horizontal angulations, incorrect vertical angulations, and incorrect beam alignment. And then we'll describe and identify proper receptor placement for bite wing images. So the dental radiographer must remember that only diagnostic images are useful. A diagnostic image is one that has been properly placed, exposed, and processed or retrieved. Whichever type of imaging receptor is used, many exposure and technique errors are possible. So receptor exposure errors that result in non-diagnostic images include unexposed, overexposed, and underexposed receptors, and film that is accidentally exposed to light. All of these errors produce images that are too light or too dark. The dental radiographer must be able to recognize exposure errors and identify their causes, as well as know the necessary steps to correct such problems. So an unexposed receptor can occur with digital sensors or film, and this is when the image appears clear. The cause is because there was a failure to turn on the X-ray machine, there was an electrical failure, or there was some type of malfunction with the X-ray machine. The correction is to ensure proper exposure of the receptor, make certain that all X-ray machines are turned on, and listen for that audible exposure signal or beep that the PID makes. Also make certain that the PID is centered over the receptor. Film exposed to light is an error that can occur only with film. And this will give you an appearance that looks black. And this again is only unique to film. And the cause was that the film was exposed to too much white light. And the correction is that to protect the film, you don't want to unwrap the film packet in a room with white light. Make sure you check the dark room for possible light leaks and turn off all the lights in the dark room before unwrapping the film. An overexposed receptor can happen with digital sensors or film, and this is when the image appears dark or high in density. And the cause was that the receptor was exposed to too much radiation. An overexposed image results from excessive exposure time, kilovoltage, milliamperage, or a combination of these factors. Too much exposure time is usually the reason why we have overexposure. An underexposed receptor can happen with digital sensors or film, and the appearance will look like an image that appears light or low in density. The cause was that the receptor was exposed to too little radiation. An underexposed image results from inadequate exposure time, kilovoltage, or milliamperage, or a combination of these factors. And a lot of the times, little exposure time is the most common. Too little exposure time is the most common cause of underexposure. So just as exposure errors may result in non-diagnostic images, errors in technique may also result in non-diagnostic images. Periapical technique errors include problems with the receptor placement, angulation, and beam alignment. Receptor placement problems. So For a periapical image to be considered diagnostic, receptor placement must be correct. This means that the edge of the periapical receptor must be placed parallel to the incisal or occlusal surfaces of the teeth and extend about 1/8 of an inch beyond the incisal or occlusal surfaces. A non-diagnostic image may result from improper placement of this receptor over the areas that you need, and inadequate coverage of the apical regions, or a dropped receptor corner. So if you have an absence of apical structures, this can happen on a digital sensor or a film, and this is when you have no apices that appear on the receptor or the image. And the cause is that the receptor was not positioned in the patient's mouth to cover the apical regions of the teeth. So to correct this, you want to make sure that no more than 1/8 of the receptor edge extends beyond the incisal occlusal surfaces of the tooth. Any more than that, then you run out of space on your receptor, making the image have an apex impossible. So a dropped receptor corner can happen with a digital sensor or film. And this is when the occlusal plane appears tilted or tipped. And the cause is that the edge of the receptor was not placed parallel to the incisal occlusal surfaces of the teeth. So a corner of the receptor may slip or drop if the patient is not firmly closed on the bite block. To correct this or to prevent this, a dropped receptor corner or to prevent a dropped receptor corner, make certain that the edge of the receptor is placed parallel to the incisal occlusal surfaces of the teeth, and instruct a patient to bite down firmly on the bite block to stabilize the receptor. So a lot of times this type of error occurs when the finger holding method is used with the bisecting technique. This is why we probably should never have the patients hold the receptor, just because errors like this can happen. Angulation is a term used to describe the alignment of the central ray of the X-ray beam in the horizontal and vertical planes. Angulation can be varied by moving the position indicating device either in the horizontal or vertical direction. And horizontal angulation refers to the positioning of the PID in a horizontal or side-by-side plane, and vertical angulation refers to the positioning of the PID in a vertical or up and down plane. Incorrect vertical angulations result in an image that is not the same length of the tooth, and the image will instead appear shorter or longer. And overlap contacts can be defined as the area where the contact of one tooth is superimposed over the contact of an adjacent tooth, and this type of error occurs with incorrect horizontal angulation. So if you have overlap contacts, this means that you have incorrect horizontal angulation. And this can happen either with digital sensors or film. It can also happen with paralleling or bisecting technique. And the appearance is you'll have overlap contacts. The cause is that the central ray was not directed through interproximal spaces. To correct this, you want to make sure that you direct the X-ray beam through the interproximal regions so that the X-ray beam hits the receptor perpendicularly, making that 90-degree angle between the two. So if you have foreshortened images, this means that you had the vertical angulation incorrect. This can happen with digital sensors or with film. It can also happen with the bisecting technique and also when the beam alignment is not used. So the appearance is you'll have short teeth with blunted roots. And the cause is that you had too much or excessive vertical angulation. So to correct this or to prevent this, you want to make sure that you do not use excessive vertical angulation with the bisecting technique. Elongated images also result from incorrect vertical angulation. And this can happen with digital sensors or film, also with any technique, including the bisecting technique, or excuse me, it can occur with the bisecting technique only and when a beam alignment device is not used. And the appearance will look like you have long, distorted teeth that are longer than the teeth actually are. And this is one of the most common errors. This means that you had too little vertical angulation. This means that the occlusal plane is not parallel to the floor and that the film is not against the tissue. Basically, there is poor film placement. So you have poor film placement in addition to the vertical angulation that will give you these elongated images. Again, the cause was that the angulation was insufficient. So it was too flat, not vertical enough. The correction is to use adequate vertical angulation with the bisecting technique. In PID, or position indicating device alignment problems, is when you have the PID that is misaligned and the X-ray beam is not centered over the receptor, which creates a partial image. This partial image is known as a cone cut, and it appears as a clear or white unexposed area on a dental image and may occur with a rectangular or a round PID. So if you're using a rectangular PID, the cone cut will appear with a linear border. And if a round PID is used, which is what we use in class, the cone cut appears with a curved border. So if you have a cone cut with a beam alignment device, this can happen with digital sensors or film, and it can occur either with paralleling or bisecting technique when a beam alignment device is used. And this will give you a clear area on the image. And then the common cause for this was that the PID was not aligned with the periapical beam alignment device. So the PID was not flush against the center of that ring. And to correct this or to prevent this, you want to make sure that the X-ray beam is centered over the receptor. So cone cuts without a beam alignment device can happen on digital sensors or film, and it may occur with a bisecting technique when a beam alignment device is not used. And again, this will look like a clear area on the image. The cause for this was that the PID was not directed at the center of the receptor. So to avoid a cone cut on a bite wing receptor when using a bite tab, make sure you position the PID careful and make sure that the X-ray beam is centered over the receptor and that the entire receptor is covered by the diameter of the PID. All right, so the learning objectives got broken down a little bit so that they weren't too long at the beginning. So we're going to go over some more things here. One of them is to identify and describe the appearances of the following bite wing technique errors due to receptor placement. And that is incorrect placement of premolar bite wings and incorrect placement of molar bite wings. Also to identify and describe the appearances of the following bite wing technique errors due to angulation problems, and that is incorrect horizontal angulation, which will give you overlap contacts, incorrect vertical angulation, which will give you a distorted image, and an incorrect position indicating device alignment, which will give you cone cuts. Also identify and describe the appearances of the following miscellaneous technique errors, which include bending, creasing, debris accumulation, something called phalangioma, double image, movement, and a reversed or backward placement. Okay, so bite wing technique errors, just as errors in the periapical technique may result in non-diagnostic images, errors in the bite wing technique may also result in images that are non-diagnostic. Bite wing technique errors include problems with receptor placement, angulation, and beam alignment. So with receptor placement, we may have, so we'll talk about correct receptor placement as well as incorrect receptor placement. Angulation problems, so we'll talk about incorrect horizontal and incorrect vertical angulation, as well as some PID problems with an alignment device and then without an alignment device. So for bite wing image to be considered diagnostic, the receptor placement must be correct. In addition to placement over the prescribed areas, the image must show an occlusal plane that is positioned horizontally and parallel to the long axis of the receptor. The premolar bite wing must be positioned such that the resulting image shows both maxillary and mandibular premolars, as well as the distal contact areas of both canines. The molar bite wing must be positioned such that the resulting image shows both maxillary and mandibular premolars, and the molar bite wing must be centered over the mandibular second molar. To ensure that the distal surfaces of the canines are shown on the resulting image, the receptor must be positioned so that the front edge of the receptor is aligned with the midline or the middle of the mandibular canine. So if you have incorrect receptor placement of a premolar or bite wing, this can occur with a digital sensor or film, and it can also occur with bite wing techniques when a bite wing alignment device or bite tab is used. And the parents will give you distal surfaces of the canines that are not visible on the image. And the causes of this is that the bite wing receptor was not positioned or was positioned too far posteriorly in the mouth. To correct for this or to prevent this from happening, make sure that the anterior edge of the bite wing receptor is positioned in the midline of the mandibular canine. So when using a digital sensor, capturing the distal surfaces of the canines can be a little challenging just because that sensor is a little bit more bulkier than the film, and your patient's, the bone in the anterior may get in the way, especially if they have mandibular tori. It can be a little challenging, so just be aware of that. If you have incorrect placement of a molar bite wing, this can occur with digital sensors or film, and then it can occur when using the bite wing technique when a beam alignment device or a bite tab is used. And this will happen, and this will look like the third molar. This is the appearances when third molar regions are not visible on an image. And the cause was that the bite wing receptor was positioned too far anteriorly in the mouth or too far forward. To make sure that this doesn't happen, you want to make sure that the anterior edge of the bite wing receptor is positioned at the midline of the mandibular second premolar. Angulation problems. So to produce diagnostic bite wing images, the dental radiographer must be prepared to choose the correct horizontal and vertical angulations. Incorrect horizontal angulation results in overlapped interproximal contacts, and incorrect vertical angulation results in distorted images. So if you have overlapped contacts, that basically means you have incorrect horizontal angulation. And this can happen with digital sensors or film, and it may occur with the bite wing technique when a beam alignment device or bite tab is used. And the appearance is overlap contacts on the image. The cause was that the central ray was not directed through the interproximal spaces. So to correct this or to prevent this from happening, you want to make sure that the X-ray beam is directed through the interproximal spaces, and that the angulation or your horizontal angulation is such that when it hits the receptor, that it hits it perpendicularly to create those 90-degree angles on your receptor. If you have a distorted image, that means that you had the incorrect vertical angulation. And this can happen with digital sensors or film. And it can occur when using the bite wing technique when a bite tab is used. And this will give you an appearance where the image appears distorted. And the cause is that the vertical angulation was incorrect. Now with bite wing images, the vertical angulation should always be at a positive 10-degree vertical angulation with the bite wing technique. And the reason is that the reason why it's not zero, well, for most patients, if you have a patient with a tall, if you have a tall palate or a vaulted palate, it should be at zero. But for most patients, the positive angulation compensates for the slight lingual tilt of both the maxillary teeth and the upper half of the receptor caused by the hard palate. So if your PID is misaligned and the X-ray beam is not centered over the receptor, a partial image results, which is known as a cone cut. And a cone cut with a beam alignment device can happen with the digital sensors or film, and it can occur with bite wing technique when a beam alignment is used. And the appearance is you'll get that clear unexposed area on the image. And the cause of this was that the PID was not properly aligned with the beam alignment device or the beam alignment ring. So to correct this or to prevent this from happening, you'll want to make sure that the PID and the aiming ring are properly aligned and flush. Cone cuts without a beam alignment device can happen with digital sensors or film, and they can occur with bite wing techniques when a bite wing tab is used, and the appearance, when the bite wing tab is used and an alignment device is not used, and it will give you a clear unexposed area on the image. And the cause for this happening was that the PID was not directed at the center of the receptor. So you want to make sure that the X-ray beam is centered over the receptor. And a cone cut image is most likely to occur when a bite wing tab is used because there is no aiming ring to guide PID placement. So when using a bite wing tab, you'll have to rely on your anatomical features of the face to kind of make an educated guess as to where that bite wing tab is or where your receptor is. So some miscellaneous technique errors that we'll cover include bending, creasing, debris accumulation, phalangioma, double accumulation, and movement or motion unsharpness, as well as reversed or backwards placement. So bending can occur with indirect digital sensors such as phosphor or PSP plates or film, and it can occur with paralleling, bisecting, or bite wing techniques. And it will appear as if the image is stretched on a film, or on a phosphor receptor or PSP receptor, it will appear distorted. Bending cannot occur with wired digital sensors. The cause of this is mostly from improper handling. When you have a receptor that is damaged, and the correction is to make sure you check the receptor placement before exposure. A receptor may be bent because of the curvature of the hard palate or as a result of rough and excessive handling. So cotton rolls can be used with paralleling technique, or if the bisecting technique can be used, we can use that instead. And also you use a beam alignment device that can be helpful in preventing bending. Creasing can occur also with indirect digital sensors or film. So phosphor plates or film. They cannot occur with the digital sensors that we use in class. The technique may occur with paralleling, bisecting, or bite wing techniques, and the appearance will be a thin radiolucent line that appears on the image. That's what it will look like on a film if you're using a PSP or phosphor receptor the crease will appear as a white line. The cause of this, again, is improper handling, or if the receptor is creased, or if the film emulsion is cracked. To correct for this or to prevent for this, you want to avoid creasing. Do not over manipulate the receptor in an attempt to increase patient comfort. Instead, gently soften the corners of the receptor before placement. So once a receptor or a plate receptor is creased, and plate receptors are phosphorus plates that are reused, and these are usually placed inside of some type of envelope that'll seal it so that there's no risk of cross-contamination between patients. And if that happens on one of these phosphor plates, it will damage it permanently, and that particular plate will need to be replaced. Debris accumulation is something that can happen only on digital sensors. It can occur with paralleling, bisecting, or bite wing techniques, and the appearance is you'll have debris on the surface of the sensor, which can cause permanent radiopaque artifacts or radiolucent scratch marks on the sensor. The cause of this is that the sensors weren't handled carefully, or they weren't wiped between uses. And debris or dirt accumulates on the surface of the sensor when there's a failure to properly decontaminate or wipe down the sensors between uses. So to correct for this, extreme care must be used when handling these digital sensors. These sensors are very expensive and they are not disposable, and therefore must be handled carefully between patients. Correct infection control procedures and cleaning off the sensors is important to prevent debris from accumulating or from scratching the sensor. A phalangioma can happen with digital sensors or film, and it can occur with the bisecting technique when a finger holding method is used. And the appearance is that we'll actually see the patient's finger or your finger if you're the one holding the receptor, which is something you should never do. The cause for this is that the patient's finger or somebody's finger was positioned in front of the receptor. To avoid a phalangioma, never allow a patient to hold a receptor during an exposure. A double image is something that can happen with indirect digital sensors, again, those phosphor plates or film. And that can occur with paralleling, bisecting, or bite wing techniques. And the appearance it will get is it'll appear as a double image or a ghost image from a previous image on the teeth. And the cause is that the receptor was exposed twice in the patient's mouth. So to correct for this, we want to avoid, or to avoid this double image, we want to always separate exposed and unexposed receptors. So once a receptor has been exposed, place it in a designated area, something like a disposable cup or a bag, away from the unexposed receptors. And if you're using PSP or phosphor plate, these PSP receptors must be totally erased before reuse to avoid a remnant image left behind on the plate from the previous use. A movement or motion sharpness can occur with digital sensors or film, and it can occur with paralleling, bisecting, or bite wing techniques, and it'll appear as a blurred image on your receptor. And the cause is that the patient, either the patient moved or your PID was drifting during the exposure. So if you want to correct or to prevent this from happening, once an exposure has been exposed, excuse me, that's the wrong one. You want to correct this from happening. You want to make sure to stabilize the tube head so that it doesn't drift, and instruct the patient to remain still. Never expose a receptor when a tube head is drifting or when a patient is moving. A reverse or backwards placement can happen with digital sensors or film. It can also occur with paralleling, bisecting, or bite-wing techniques. And the appearance you'll get is a light image with the herringbone pattern on the image. So that is that little bumpy line that's on the backs of our of some of our the little aluminum plate or the little metal that metal sheet of paper that's placed inside of your film packet. And the cause for this type of backward placement image is that the receptor was placed backward in the mouth and then exposed. So to correct for this, you always want to make sure that you place the white side of the receptor adjacent to the teeth, and that the white is in sight method is used to where that you're always able to see that white part of the receptor or the film, and then it's placed towards you and towards the PID. Okay, that's all I have for this chapter. As always, if you have any questions, feel free to email me or ask me in class. We'll talk to you soon.